Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about a very common problem, and that is high blood pressure or hypertension. High blood pressure is diagnosed when the reading in the mercury manometer is more than 120 upper value and 80 lower value. Low BP is said to be less than 90 by 60. Low BP seldom occurs unless there is bleeding or some other reason for loss of blood. If your BP is less than 90 by 60, you will probably faint and fall down. The problem with hypertension is that it is like a thief who comes to your house in the night. You do not know he's inside until he catches you by the neck. BP is exactly like that. Hypertension creeps on silently and causes no symptoms, and it is usually diagnosed when the BP is checked by accident for some other reason. Then the person will say, I don't have any symptoms, how can I possibly have hypertension? Hypertension is like that, and it is a dangerous disease. Most of the sometimes, if you are lucky, your hypertension is due to a secondary cause like endocrine problem like parathyroid hormone or some kidney disorder, abnormal kidneys, or even if you are pregnant, the pregnancy itself may precipitate a hypertension. This type of hypertension will disappear if the primary cause is removed. But the most common type of hypertension is primary hypertension, and this usually requires lifelong treatment. It tends to occur in families, and it can come any time after the age of 20. It is more likely in people who are fat, who are inactive, and who have other diseases like diabetes or high cholesterol, and in whose families there are plenty of people also having hypertension. The heart is a pump, and the heart has to pump blood all over the body. So when there is hypertension, the heart has to work much harder, and after some time the heart may fail and back pressure may build up. As the heart pumps the blood very hard into the blood vessels, small tears and scars occur in the inner lining of the blood vessels. The fat, especially the low density lipoproteins, go and get deposited on these tears, and then atherosclerotic plaques build up and block the blood vessels. This block can give rise to heart attacks, it can give rise to kidney failure, and if it occurs in the brain, it can give rise to strokes. Sometimes if the blood supply to the brain is compromised like this, there may not be a stroke, but there may be vascular dementia, and the person's behavior, attitudes, and comprehension may change. In order to control blood pressure without tablets, first 3 readings have to be taken, and all the 3 readings should be high. Sometimes the blood pressure may just go up because of anxiety, because the person has drunk a cup of coffee just before coming in, or just the tension of seeing the doctor. That is why 3 readings are taken. If the 3 readings are high and tablets are started, remember that some tablets act for 24 hours, some act for 12 hours, and some act for 8 hours. So it is very important to take the tablets exactly as they have been prescribed at the correct time intervals. These tablets do not necessarily have to be taken after food, so you can eat them on time and just eat a biscuit or some other light snack before taking the tablet. If you have fasting, you cannot take the tablet at 12 o'clock on one day and at 8 o'clock in the morning on another day because you are traveling. This will cause your blood pressure to go up and down, and that also is dangerous. Usually 1 tablet is started, and the dose of that tablet is increased until the blood pressure is controlled. Only after the maximum dose of the first tablet is reached is a second tablet added. So please do not think my neighbor is taking a better tablet for blood pressure, her blood pressure or his blood pressure is controlled better than mine. Your doctor will control your blood pressure, but sometimes it requires repeated visits in order to do so. Supposing you want to cure your blood pressure without medication, then there are certain things you have to do. First of all, you should walk for 30 minutes a day. You should come down to your ideal body weight. You should control any other diseases like diabetes. You should control your blood lipids. The salt also has a role in blood pressure, and the salt consumption should be reduced to half a teaspoon per person in the house per day. So depending on the number of people, if there are 5 people, you can have 2 teaspoons of salt in all the cooking. But sodium and salt is not necessarily just what you add to the food. It is also present in sauces, in jams, in preservatives, in chutneys and powders and pickles. So you may be taking a lot of salt without realizing that you are doing so. If you ignore your blood pressure because you don't have any symptoms, then you will eventually suffer a lot of damage to the organs in your body. So everybody, stay healthy, stay happy, exercise regularly, control your blood pressure. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe and press the bell button. The same content is available in Tamil. Thank you.